It's common to encounter a child who presents to the emergency department with a head injury and a hematoma. And this is where ultrasound can actually be very helpful, and when you perform a skull ultrasound to find a fracture, as this can help you decide whether or not this child needs a CT scan. To perform a good skull ultrasound, you need to apply lots of gel to the area to minimize pain and anxiety when performing the ultrasound. It's also important to scan at least 1 to 2 centimeters beyond the hematoma to make sure you don't miss any fractures. And also really important to differentiate between a fracture and a suture line, especially in the young infants. Now, the way to do that is make sure you know your anatomy well, but also you can follow the suture line all the way to a fontanelle, and that would help you determine what that is. And it's also helpful to compare the area to the other side of the skull to determine whether that is possibly a suture line and not a skull fracture. Now, be careful, because you can also fracture through a suture line, and what you would see is a widened suture. And again, comparing to the other side is key in this area.